Good afternoon. I'm Karen Holmes Ward. Welcome to Cityline. Massachusetts is a world leader when it comes to health care and universal coverage. Now an effort is underway on Beacon Hill to make access equitable. The Health Equity Compact, a group of professionals dedicated to addressing systemic issues in medicine, is promoting legislation that builds in accountability. According to a Blue Cross Blue Shield of Massachusetts Foundation report, health inequity among people of color costs the state $6 billion each year. The proposed solution includes the creation of an executive office of equity, requiring providers and insurance companies to use the same data to track inequity and make it public, creating job opportunities for people of color in the health system, and lower medication costs for chronic conditions. Joining us now is Dr. Thea James. She is Vice President of Mission for Boston Medical Center and a member of the Health Equity Compact. Welcome to Cityline. How are you today, Dr. James?
Thank you for having me. Good morning.
Good to see you. So what are we talking about when it comes to health equity? What are some examples of inequity in healthcare?
Well, what we're talking about is structural barriers that prevent people from being able to thrive, and various different things contribute to thriving. You know, it's more than just taking your medication, but it's also being able to afford them. It's being able to have housing. It's being able to have access to economic inclusion, which is really at the root of it all. And so when these things are not in place, people can't prioritize their health. And because they're focusing on prioritizing survival. But there are lots of ways in which we can address those issues and not just accept the data we see all the time as, an expected norm of certain populations. It's so predictable. And so we're actually trying to create some structural mechanisms in terms of standardizing health equity in our state government.
So, Dr. James, whenever we mention this next fact, I'm just continually shocked. The maternal mortality rate in the U.S. is higher than in any other industrialized nation. Just amazing. This summer, Attorney General Andrea Campbell announced $1.5 million in grants to expand maternal health care in Massachusetts. Medical centers in line to receive the grants say that most of the current problems involve language and transportation. Is that in line with what you were seeing?
Well, to some extent, but actually it is a deeper problem than that. And I really think that you cannot, and we're all here to try to help each other. And I think we should share best practices and things that have proven to be a proof of concept. And I would say that Boston Medical Center here is no different. Everybody in the country is aware of these disparities in maternal health. And so I think what has to happen is we can collect the data. The data is going to show the exact same thing. We cannot look at the data and interpret it based upon what we think it represents. We don't really have true context to that to explain the data. So I think it is really, really important to actually involve and include and engage the subjects of the data. And when you're looking at the data, that's just a disparity gap that you're looking at, but you have to interrogate that data back to root cause. And the only way that you can understand root cause is to engage the subjects of the data. They know what can lead to these disparities. We really don't. And I'm using this as an example of something that we were able to do here. And it has led to closing some gaps.
Tell us, if you would, how the compact and the bill is targeting some of those root causes.
So the bill is actually meant to enact to advance health equity is the bill. It's actually attempting to establish a secretary of health equity in our state government. In that way, we would be standardizing, collecting data, reporting on the health data, which would also, lead to improving access to quality of care. But it also holds health systems accountable, for what they find in the data. It's not just reporting it out, but also, once again, focusing on the root cause of the data and operationalizing systems that can actually lead you to that.
A Mass Inc. poll shows widespread support for moves to advance health equity. 80% of Massachusetts residents agree that some groups of residents do face more obstacles to getting health care. And if this issue is so widely known, then why has it continued for so long?
Because there is a certain mindset. It's just such a dominant narrative that there is an expectation that, certain people will not fare well. And it's highly predictable who those people are, where they come from, but no one ever questions it. You cannot get to the answer of something like that if you don't have intentionality to find the root cause. And many times when someone, speaks about or suggests the notion of getting to the root cause, people say you can't boil the ocean. And you will never solve the problem that way. So we have to actually use standardization and accountability and intentionality and support healthcare systems and others to be able to get to the root causes of these things. It is not super difficult. I think the easiest pathway to finding out the root cause of the data and helping us to actually close these gaps is, once again, to start with the subjects of the data. And I'm speaking from experience. It is a much more efficient way of doing things. And it's also a much better business model, quite frankly.
Dr. James, let me ask you the question from a slightly different angle. Nationwide data on health and equity is well known in the healthcare industry. But why does there still appear to be a struggle to see meaningful results? Where's the disconnect?
I think the disconnect is there's no accountability. There's no intentionality. It's not standardized. No one actually is charged with, looking to solve this problem. And again, it's also driven by, the expectation that it can't happen. It's not possible.
We mentioned at the top of the show the financial cost of healthcare inequity is about $6 billion a year. What do you see as some of the other societal benefits to addressing inequity?
Well, certainly, we can help our GDP, for example, because when people are not doing well, it costs the state and the country lots of money to take care of people. And if we enable people with the ability to thrive, and again, I really believe we have to start with economic inclusion, people will be able to contribute to our economy in many different ways, but particularly they can contribute to the economy, decreasing the cost of that we spend in taking care of people and poor health outcomes, and actually we do better all together.
Dr. Thea James, Vice President of Mission at Boston Medical Center and a member of the Health Equity Compact. Thank you so much for joining us. Up next, the diagnosis and treatment of breast cancer, the disparities women of color in Massachusetts may face, and the changes when CityLine continues.